But one of the reasons is it would be unlawful for me to go on strike about a bill that's in Parliament, because we have some of the most restrictive trade union laws in the country. But actually this is important to people, because good public sector pensions mean that you get well-rewarded public sector workers that deliver high-quality public services. But that figure I was somewhat for, nurses, other health workers retiring at 68, and actually I think 68 is a bit of a misnomer, because I'm 29 now, which means my pension age will be 68 under these proposals. But actually, they're saying this will be fixed to the state pension age, and I have no confidence that that will be 68 by the time I get to retire. So we're talking about nurses, other health workers working into their 60s, 70s, and how is that good for patients? There is what we thought, you know, we like to think about what the silver lining is about, and I have got one here. Because when I'm trying to teach a patient how to use their new liver frame, at least I'll be able to demonstrate how I use my own. And one of the big things is this is part of a broader attack on public services. I think actually the prize of this isn't even the extra money they're trying to get out of us and the extra savings they're trying to get out of paying us less pension. The big thing about pensions is they want to scrap that fair deal on pensions that we agreed with the last year to allow people to be stripped off into the private sector with not a penny of pension provision going with them. It's absolutely disgusting. Now, at that new QE hospital, it has many issues, and it could have been designed by people that actually work in hospitals. But we're really proud as local unions that we were the first PFI hospital in the country to retain in-house its porters, cleaners, switchboard staff, catering staff. We've still got a restaurant that's cooked by excellent food, actually, by in-house NHS employed staff. Really proud. And one of the reasons we achieved that in our negotiations was because the private sector don't want to touch having to provide as good pensions as we've got. And this is all about opening up the public sector to ease these privatisation. And that's one of the things that's motivating my members to come out on the 30th of November. My cleaners are really glad that they're in-house. They're part of the team that runs the wards. They're part of the team that's proud of their hospital. And they do not want to work for private companies. And they know that if they do this, it's just a step closer to that. And I think we need to think about some of the things that the media and the government are going to say. Because we've already heard that it's public versus private. And yes, it is about public sector workers. But actually, in UNISON, we've got huge chunks of people on this strike action that are not public sector workers. The workers in housing associations, the workers in private companies that have been transferred out, particularly in the local government pension scheme. A big chunk of members of the local government pension scheme are actually in the private sector. And yes, we need good pensions in the private sector. And my answer to anyone that does all the public sector is the union. You know what the answer is? It's to unionise the private sector. Yeah. We need to be doing that much more. We need to be working in companies like Comfort, like Circle, and making sure that we're in those companies. Because the only answer to bad terms and conditions in the private sector is good unions in the private sector. One of the things that the health service was particularly acute to is we know we're going to get attacked next week for putting out this. Now, no health professional is going to take part in education in a serious way. And that's why we're working really hard with our employers. Often intransigent employers that don't want to talk to us about this, but working hard with them to make sure we have emergency services. We will not be closing the A&E department at the QE. If you're on strike, you're on the picket line, you cross the road and you get run over, you will have an ambulance to pick you up, you will have an A&E department to go to, and you will have really high quality care to look after you. So don't listen to any of that. Because people have already said, you know, if you can have be off on a royal wedding, you can be off on a Wednesday. It's absolutely gobsmacking to me that we have people saying it's unacceptable to go on strike for people that don't work on all the bank holidays. Well, of course, one extra day off is not going to make any difference to people. And I also think that the other argument that will always come out when we're taking strike action is that you're holding the country to ransom, you're holding the country. And I didn't read the case, but I said it in Bible. But I saw the Telegraph on page today, and I'm a bit of a cynic. But I don't think it was a coincidence. The headline was that poor cancer outcomes because we pay staff too much. I'm not sure how that works, but apparently it's because we pay staff too much. The fact that actually our cancer survival rates have improved at a faster rate than any other country in Europe is because we've got highly motivated, well-qualified staff that have been able to do that. But the other story under that was about how much the 50% tax is costing. And then it's going to cost millions of pounds because rich people are going to go overseas. Well, if I can't go on strike, why can them buggers go on strike? Why can they riches move their noses? I think we need to be getting about who's holding the ransom. One day strike action's not holding the ransom. Not holding the ransom. The fact that people say, if you tax us as much as you tax the cleaners we employ in our back, that we'll leave the country, that's what's being held to ransom. And that's what people have to say, no, that's unacceptable. That's right. But you know what, if you want to go, we'll have a whip round, we'll pay for your plane ticket. But it is important, and it's particularly important for us in the health service, that we get support from other people. We've never done this. We have done this before, but my branch committee, there's one person on my branch committee that's ever been on strike. And that's my retired member. So we need help, and we need confidence. And the fact that people are striking across the public sector and across public services has really built the confidence of our workers. But we need the general public to support us as well. We need you to join us in the rallies, come and visit on the picket line. But we need you to speak out and speak up with patients. We need you to ring into radio stations when they're saying anything terrible that patients have got the risk to say, well, actually, I'm a patient at that hospital. I might have had an outpatient appointment today, but if I had done, I wouldn't have gone because I support the right of healthcare workers to strike and the right of them to have decent pensions and to be able to retire and not trying to be giving me care when they're in their 80s. We need you to be supporting us. And that's because we are there to support you. And one of the things I want to leave you on is what my General Secretary said in his speech this summer at the Impact Conference. Because I think this is key about why we need to take strike action sometimes in the public sector. Is that sometimes to show people your work, you've got to show them what it's like when you're not there. That's what we're doing on Wednesday. That's why we're taking action, and that's why we need to stand.